too is, nurses are getting burnout. And one of the things that can help with burnout is connection. So hopefully
100%.
provide that for people so we can help on that end of it, because it's definitely not getting any better from the burnout perspective. That is.
Hello, and welcome to the Art of Emergency Nursing podcast. This is where we share stories for inspiration, entertainment, and encouragement, because we all know emergency nurses have the best stories. Now here's your host, Kevin McFarland.
Hey everyone, Kevin McFarland here from the Art of Emergency Nursing, and thanks for listening to the podcast, and thanks for downloading this episode. I hope you're doing well. Hope things are going good for you. If you're listening to this in real time, this is about February 2022. It's almost March, and I got some cool things happening that I wanted to share with you. First, and what I'm very excited about is I will be in Atlantic City, New Jersey. Yes, I can't wait for the New Jersey ENA conference. If you're going, or if you're going to be in the area, I hope you get a chance to say hello. I'm going to be doing the closing session for that conference, and I couldn't be more excited. It is one of my favorite ENA conferences to go to. Oh my God, it's such a good time. It's a great conference. If you are in the area, you don't want to miss it. You definitely want to make sure to go. Also, and just as exciting, I'm about to launch a second podcast. I know, what am I thinking? And this one will have a more clinical focus. It's going to be a little bit different from what we have here at the Art of Emergency Nursing. The co-host is going to be none other than Dr. Lisa Wolf as the co-host. This podcast is going to be focusing a little bit more clinical, and it's going to be called How Not to Kill Your Patient. I hope you get a chance to go check it out. I think you're going to dig it. I'll give you a little taste of the episode at the end of this podcast if you want to take just a quick little preview listen. Well, that's it for the announcements. Let's get to today's episode. My guest today is Ron Kraus. He is a clinical nurse specialist from Indiana. I had a chance to sit down with Ron late last year, not long before I thought I was going to get to see him at the conference. Of course, that didn't work out, but we did get a chance to talk a little bit about the conference, get a chance to talk a little bit about his time as the president and all the super cool things he got a chance to do. You're going to really love this episode with my friend, Ron.
Yeah. So hello, everybody. I'm Ron Kraus, and I'm currently a clinical nurse specialist at a level 1 trauma center in Indianapolis, IU Health Methodist. I've been there since 1998. I started off my career in another emergency department, St. Francis, which is on the south side of Indianapolis as well, for about 2 years, actually about 18 months, I think. And then I went up to the trauma center, which is where I kind of really wanted to go to and end up at. So, and I've been in a clinical nurse specialist role now since 2009 and supporting the same department that I came in and started off, the night shift guy, and then went to day shift and did some charge nurse stuff. And I eventually wanted to try to roll my way up to as a flight nurse. So I was able to fly for our program a total of 5 years, and then got out of that and was doing some clinical orientation coordinator, kind of onboarding new people, helping our educator out. And then I went back and got my clinical nurse specialist degree. So that's where I'm currently at right now. And then I'm also currently serving. I have the distinct pleasure of serving as the 2021 ENA national president.
Very cool. So tell the audience a little bit about clinical nurse specialist, because and for me, I don't know as much as I probably should, but that's a role you don't see in all ERs. You don't see it all across the country. Tell the audience a little bit about being a clinical nurse specialist.
Yeah, I selected the right way. That's for sure. So it's an advanced practice nurse with a master's degree. And we really kind of work in what we call 3 spheres of influence. And the one sphere of influence would be working with difficult patients. And then the other one would be working with the provider. So we got the patient and then the provider. So helping our nursing colleagues be the best they can in elevating their career and their profession. And then we also work at the system sphere. So I might sit in on a meeting for the entire system or the whole hospital. And, one of the cool things about a clinical nurse specialist position, I think, is, when you're in a leadership role, but I don't have any ability to hire or fire anybody. So kind of my job is to get in there and ask the questions and develop relationships so people can tell me like, hey, Ron, I don't do it that way. And I find out why they don't do it that way. And I can help remove the barriers so that we can deliver the best care without going through all these unnecessary hurdles. So it's a constant flow for me. I work with my inpatient colleagues that are clinical nurse specialists, and they might be over a certain specialty like the ICU, or they might be over transplant. So I'm their conduit between all of those, because obviously in the emergency department, we touch all the service lines. So I kind of work with those, the stroke coordinator, the sepsis coordinator, the ICU, the OR. We all kind of work as a team to make sure that the transition of the patient care all the way through the system is optimal. So, I probably the favorite sphere I like to work in is the nurse sphere. I really like mentoring and helping, teaching, help getting nurses to be the best they can be. That's kind of my jam. That's where I kind of really like to be.
That's awesome. It sounds a lot like, so what we call the professional development specialist. So it sounds a lot kind of like that, where for me, we have our clinical nurse educators who are on the units. And then for me as the nursing professional development specialist, which is not an advanced practice, but it's a specialty of just kind of like service line specialty. So I work with the emergency departments for both campuses and try to look more system level, not like at department level. We try to look more system level, remove those barriers, try to make things
and looking at all the quality indicators and how we, diving down for the stroke patient and where can we cut off and shave minutes, and then working with everybody to make that happen. So
that's cool. What a great role.
It's fantastic. And when I went to go get my advanced practice nurse, I didn't really know about it, to be honest with you. And one of my colleagues who worked at the pediatric trauma center said, "You know what? You really think like a clinical nurse specialist. I think you really should try it out." I'm like, all right. I knew I didn't necessarily want to be a nurse practitioner. I didn't think. I thought about nurse anesthetist, but at the time, I would have had to uproot my family and move to a different city, and I wasn't just willing to do that. So I went and I jumped in kind of blindly into this after a little bit of investigation about what a clinical nurse specialist does. And man, it's awesome. It worked out great.
That's awesome. What a cool thing to find your niche and be like, okay, this is what I'm supposed to do.
Yeah, absolutely.
That's very cool. So how long did you say you've been a nurse?
I got my nursing degree in 1996 from Indiana University. So
nice.
I was to be completely transparent, it was a 7-year degree, Kevin. So, I mean, people can laugh about that. What do you call people who go to college for 7 years? Usually doctor, but not me. I started off as a biochem major.
Okay.
And I had aspirations to be a dentist. And so that's kind of one of the funny stories about, I had a discussion with my father at the time, and he's like, "Do you really want to be a dentist, or do you want to be a dentist because of the money?" And I kind of thought about it, and it's really kind of focused on the money more than it was being a dentist. And he had a great career. He sold fertilizer and worked with farmers, and he loved his job. So he's like, "You got to pick something that you love to do."
I got to tell you, it makes it a lot easier to do it every day, doesn't it?
Oh my gosh! And Boy Scouts, I always liked first aid. So I had my ex-brother-in-law was a paramedic. So I was always around him when when they did like moulage classes and mass casualty incidents. I would be the guinea pig because I was, like 8 or 9. And I just thought that was all cool. So I was like, well, maybe I'll go to nursing school. Maybe I'll work in the emergency department. So here I am.
That's cool. That's really cool. And then you went on to flight nursing. How'd you like flight nursing?
It was awesome. It was a great opportunity, to be, if you look back at probably, the 3 spheres of influence for CNS, and the one to be in the patient sphere, that, when I was flying, I felt like I was obviously the top of your clinical game, and just be able to work with so many people and outreach of other, EMS providers, as well as other hospitals that you're going into and out of, and seeing great people and meeting all kinds of amazing people. It was awesome.
Yeah. That's really cool. I love that. When I went to school, when I went to nursing school, my thought was I wanted to be a flight nurse. And that was the only goal, like to be a flight nurse. I was going to work in the ER long enough to become a flight nurse. And then that path all changed, but never ended up doing that piece and never got to the point where I just didn't want to. But man, I never regretted going for the ER. Like I never regretted becoming a nurse, never regretted being an ER nurse. So
yeah, yeah, when I was going through nursing school, some of the med surg clinicals there were some good parts about it, but there were some bad parts too. And I was like thinking to myself, I don't know if I made the right choice here, switching from biochemistry to nursing, and then had the opportunity to take a summer class in the other level 1 trauma center at the time in the city of Indianapolis. Was called Wishart, but it's called Eskenazi now. And I was like, bam, here it is. I know exactly what I want to do. It's in the emergency department and it's right here. So that was an eye opener. I'm like, all right, I can trudge through OB and I can trudge through all the stuff to get on the other side of this because I want to be an ED nurse.
Do you remember your first day in the ED?
I do. When my first job, I had a great preceptor, and I just remember her very well, like checking in a patient, like we did stuff together, and then all of a sudden it got busy and she's like, well, you can go check that patient. And I just remember checking the patient in, and she come in there, and it was a motor vehicle crash, and I didn't ask her all the right questions. I didn't ask where they were in the car, how fast they were going, was there interior damage? I didn't ask any of that. And she's like, how do you even know what's going on? How do you know how to assess this? And I was like, oh, but it was great. It worked out great. She was fantastic and amazing. So
that's cool. That's really cool. So yeah, I still remember my very first day in the emergency department so vividly. And I don't remember my first days as a nurse. I became a nurse. Yeah, I worked in the ER for a long time before I became a nurse. And so I don't remember that quite as well, but I still remember being like, okay, this is my fit. This is what I'm supposed to do. This is going to be it. So
yeah, when I had that summer class, I was like, this is it. I knew exactly what I wanted to do.
That's awesome.
I had a student job in the ICU at the VA hospital here in Indianapolis, and which those nurses were fantastic as well. I had a great experience with them. But at the time when I got out of school and graduated, there were no jobs. I know it sounds crazy right now if people listen to the podcast today, but there's no jobs to be found, especially new grads with no experience or minimal experience. I saw one of my professors. I was waiting tables while I was my last 2 years of nursing school. And she came in and she was at one of my customers at her table. And she's like, it was towards the end. And she's like, so you got a job yet? And I'm like, no. She goes, you just got to go for it. You just got to go for it. And I'm like, I know, but I can't get past nurse recruiter, blah, blah, blah. And so my dad, again, throwing out some great advice. He's like, Ron, you just got to put a suit on and go to the emergency department and ask to speak to the manager. So I was like, okay. So that's what I did. I went to this hospital that I got hired at the first time. And, I knew through my ex-brother-in-law that had the paramedic down on that side of the town. And he's like, I know there's positions open. So I went to the triage desk, asked if I could speak to the manager, brought my resume. She interviewed me right there in the waiting room and got a job.
That's awesome. I love that story. Tell me about a patient that changed the way you practice.
Wow, that's a tough one. I don't know. That's a really good question.
It's a tough question. They get harder. It's the easy one.
Oh, that's the easy one? Boy. I don't know if it's the way I changed my practice, but it really has instilled some, just some things to think about. And it was actually when I was a student and I took care of this guy. I go in and I'm getting his pulse and feeling for his pulse. This might have been maybe my second semester of clinicals. Yeah, I think so. And I couldn't feel for the pulse. I just couldn't find it. And, the guy's obviously talking to me. So I know he's alive and all that jazz, but I'm like feeling for it on his wrist. And I go, sir, can I try your other wrist? And he's like, yeah. So all of a sudden I felt his pulse and I started taking it. And he goes, oh, good job. He goes, you know how many people find my pulse in there? He goes, I don't have my nerve, my radial artery. It's not there. And it got damaged somehow, some kind of surgery. And he goes, you know how many people come in and put their hand on my wrist like that and write down a number?
Oh no.
Yeah. Stop. So to me, it was like one of those, I was like so nervous. I'm like, am I doing it right? Am I doing it right? And then I got on the other side and he did one other thing that was really, kind of set with me. And I just kind of, not necessarily like clinical practice, but I went in there, did something, and I moved a bedside table out of the way. Right. And I put the rail back up and whatever. And I start to walk out of the room. And he's like, hey, you going to put my table back? How am I supposed to get to my glasses and the phone? It's my table's over there and you moved it. And I was like, yes, sir, you're right. And so I think it's just one of those things that just kind of set in my mind of like how to do things right. If that makes sense.
Yeah.
So, I mean, it's not no crazy story that set me off, but I just remember him very vividly. And it just, yeah.
It's funny how just those little things will like change the way you do things. They'll like change everything. They'll be like, yeah, I can't forget that. Like
going from like, just making sure your room's neat and cleaned up. You start an IV, make sure you take all the trash out down with you. You put everything together. You put the rail up, you put the bed down. Everything's copacetic before you leave. Everything's good. I think that kind of helps me. Like I said, it's very vivid in my head. He's like, hey, you gonna move my table back? I'm like, yes, sir. Yes, sir.
Yeah, I am now. It's kind of funny how just those little things like make you go, okay, I'm never going to forget that. Like I'm always going to remember to put the table back, introduce myself, say hello.
Yeah. I mean, just all of those things, right?
Yeah. Tell me about the first time you made a med error.
Ooh. Well, I was in orientation.
Good to get that. It's good to get out of the way early.
Yeah. Well, it wasn't my only one, Kevin. So
yeah, I wasn't going to ask about your last med error. Well, we can talk about that too. I mean,
we can talk about that one too. And it was morphine, and I think if I recall right, maybe only 2 or 4 milligrams was ordered, and I gave 10.
Oh,
yeah.
That'll take care of the pain.
Yeah. So
and the breathing and the heart rate.
Yeah. So I was like, as soon as I did it, I gave it. I turned around to write it. This was back in the paper charts. I turned it down to write it down, and I was like, oh my God. So I quickly went and got my preceptor, and she's like, oh, well, let's just take his vitals and let's keep an eye on him. Let's go tell the doc. You write it up and all that jazz. You learn the lesson, but the doc was super cool about it. My preceptor was cool about it, but also, this is where you mess up. You don't do it again. Like one of those kind of things. So I was very fortunate that it wasn't something else and worse, and there were no bad outcomes from it. But, I always tell people it's not about if it's when you might make an medication error. So, but man, my gut, it just dropped when I turned around and looked at it. Oh my God. Oh, you're
like, oh God, I'm done.
Yeah. I was like, well, I better go get my preceptor. I better go get the doc. Make sure it's all right. Oh boy.
We're going to be bagging this fool here in a minute.
Yeah. Well, luckily he was a bigger guy. He was, not opiate naive. So it turned out to be fine, but
yeah, that's good.
Certainly, we all know it certainly could have been worse.
Absolutely. Yeah. It's one of those where you're like going, yeah, you do that. And then you're like, oh, wow, what just happened?
Mm-hmm.
So, but then the good news is that like the next time makes you like super paranoid. Like I'm going to make sure.
Yeah.
What out we go right there.
Yeah, exactly. And I think it's important for me to share that with newer nurses. When I was precepting and on the floor, I'd tell them, hey, I'll tell you a story about a time I jacked a med, and here's why I jacked it up. And so that they can be aware and maybe looking on that aspect of it so they don't do that. I should have double checked it before I gave it. I thought I knew what I was doing. And I went in, I gave it, turned around and realized that wasn't the dose that was ordered.
Yeah.
Just sharing those stories and stuff with people, I think, can benefit and help somebody else out too.
Yeah. Speaking of stories, tell me a story about a patient who touched your heart, a patient that you'll never, ever forget.
Wow. There's probably two that I can think of that I vividly remember. One of them was a young girl, probably 16, 17 years old. Never got to interact with her because she was already intubated when she came in, but she had been involved in a motor vehicle crash. And exteriorly, she looked completely fine. A non-survivable head injury. So, one of the things in the emergency department too, I think that some people like the emergency department because you don't really get a good connection with some of the patients, and you put up that wall. And I just remember the parents coming in and after the neurosurgeon left and told him that it was non-survivable. And I was in there, saying that I'm sorry. And just being with him was incredibly hard. I couldn't tell you the girl's name. I can see her completely still in my head. I can still feel the parents' reaction. That's a tough one. And, now being a parent, who I have a 16 and almost a 17 and almost a 16-year-old. So now that even more as I talk about it right now, it's just like one of those gut wrenching things. So, and then the other one, I think it's kind of cool. When I walk in, introduce myself, take care of patients, I always kind of like just make an observation, right? Are they wearing some kind of team hat? So you're like, oh, so you're a Bears fan, or you're a Colts fan, or you like the Cowboys, or what, it's just something to make a connection with them. Yeah. And this gentleman was an older guy, and a lot of times I will look over like at their age too. And this guy was in the right age range to serve in World War II, and back then pretty much a lot of people did. And I said, so, sir, did you ever serve in the military? And he's like, yeah, served in the Army. And he was talking about like during World War II, he was over in Europe. And he told me a story about his company going into a concentration camp and opening the gates.
Oh, shoot. Holy cow. That's big.
Yeah. So it was just a really cool connection for him to talk about it. You could just see the pride that he had and then also the devastation that he saw, and go into all the details. But I was just like, wow, sir, thank you so much. I don't know. It was just one of those connections I didn't expect. I was gonna say, oh yeah, you served in the military. Yeah. And then I just didn't expect that to come out of his mouth. And so those are kind of people that are stuck in my mind over the years. So just at least 2 of them.
Yeah. Holy cow. What a cool story. What's the best advice a nurse mentor ever gave you?
I think it probably came a little bit later in my career, as I was getting busier with more things. I had a mentor tell me, I think I was kind of getting frustrated with myself, with all the stuff that was going on. And, she told me, listen, your plate is only so big, and you pile enough stuff on it, the stuff's going to fall off. And stuff's going to fall off on the floor. So you have to be able to manage how you react to that. And really kind of turned out to be having her suggesting to me that I connect with like a life coach or a career coach. And I did it through my employer, and it was probably one of the best things that I've ever done. From a standpoint of me getting better from an emotional intelligence aspect, an expectation management aspect. There was just a lot of things that has now helped me as I'm moving through my career, that I'm glad I did that. So it wasn't like a piece of advice from her, just more of a I would suggest, I've done this, Ron. I've had one of these before. Why don't you try it? Yeah. It was good. I mean, it was a good advice. So, not everybody has access to those through your employer, but what I think what a lot of us have access to is other people and a mentor. Yep. And Kevin, you and I were talking a little bit earlier before we started, doing the questions. It's the networking, and if you have the ability to connect with somebody and just open discussions, I have the privilege of mentoring, some people right now, and then I've mentored across, during my career, but I get something out of it too. I get something out of just the discussion back and forth. That helps me become a better person as well. Yeah. I reach out to a mentor, get somebody and connect with somebody who can help you through your career. That is for sure is key. Yeah. It's too tough. Nursing, especially ED nursing, is extremely difficult.
It's hard right now.
It's hard right now. So if you, and I say this a lot when I do my ENA things, but the only people who get ED nurses are other ED nurses. So connect, understand, and you can kind of work with each other in strength in numbers, I guess, if you will. So
that's cool. I like that advice. That's really good advice. What advice do you give brand new nurses looking to start their career in emergency nursing?
I think we probably all felt this way when you got out of nursing school. You got A's. You thought, this is great. I must know everything.
You're like, I got this.
I got this. I know everything. I'm good. I'm good. And then you get into reality. And so I always tell new nurses is like, listen, you might have been a straight A student and you might have been fantastic in clinicals, but kind of sit back a little bit, listen. Yep. That old advice of you got 2 ears and 1 mouth for a reason, so you should be listening twice as much as you're talking.
It's true.
So kind of soaking it all in. And also, I think I see it now with a lot of our newer nurses that are coming through. They expect to know it all right away. And they get frustrated if they're not. And so I always like tell them, especially now, it's like, give yourself a little grace, give yourself a little latitude. Yep. You're not going to learn everything overnight. You should always be constantly learning. And I don't know. I mean, I probably was a good 1.5, 2 years, maybe 2.5 in to feeling like I could probably handle most anything walk through the door, right? I mean, at least get us going and get us started.
At least get started.
When you walk out of nursing school, you think you know everything, and it's so frustrating. When I just remember being frustrated when people say, "Well, you don't know everything." Well, but then when you get on the other side of it, you look back and you're like, "Yeah, there's a lot of stuff I didn't know."
Yeah, so totally the way it goes. You're all of a sudden you're like going, "Oh yeah, who knew? Who knew that?"
Yeah.
So
just sit back, listen, learn, and give yourself a little bit of grace.
I want to talk a little bit about your role as the Emergency Nursing Association National President. Now, tell us a little bit about your journey to 1, join the board, 2, then become the president. Like how cool is that? How does a guy from Indiana, not one of the big states that are typically represented, in a huge way at the conference, how did you end up getting on the board, and what do you like so far about it?
Yeah, it was a really funny story. Probably 5 days into being an emergency department nurse, I joined ENA. I just know that's the professional thing to do to support your professional association. So I joined, never went to a meeting. So, like I said, I was at my first hospital about 18 to 20 months, I think. And then I went up to the trauma center, working night shift. And one of the night nurses, Greg, he's like, "Are you a member of ENA, Ron?" I'm like, "I am. I've never been to a meeting." He's like, "Well, why don't we go to a meeting sometime?" And this is before I knew much about ENA, right? So it's called the Indy Roadrunners. And I honestly thought it was a subgroup of ENA that did road races, like running. I think that's a funny story. And I'm like, "Greg, I'm not a runner." He's like, "Dude, no, that's the name of it." And then then he tell me this whole story about the Roadrunner, how he got the name. And anyway, so we go to our meeting. Him and I are pretty involved. And it just started off, anybody who goes to an ENA meeting, you kind of, you hear about stuff and you're like, "Oh, yeah, I'll help out on that. I'll help out on that." And then, one committee led to another committee, and then, the local chapter, a president, and then, and then did stuff with the state. Yeah, go ahead.
And then what made you have the audacity to say, "Hey, you know what? I'm going to run for national board." Because there's 50,000 members, and you're like going, "Yeah, I'm going to be one of the people running this stuff."
Yeah, it really didn't really set on me there for quite a while. When I was state council president, I thought, how far can you go? I thought about that, but then I had the ability to go through and co-sponsor a resolution in GA, and I really kind of got the bug. I kind of got the bug for the whole thing, and then and throughout my career, I've had opportunities to step into leadership positions, and I learned something new from each one of them. So when I want to join a group, I help out, and then so a lot of times, and sometimes I just get to a position where I'm in the lead spot, and I just really wanted. I don't know. It was a desire of mine to be on the board, and then when I got on the board, I wanted to be. I said I want to go for president.
That's cool.
And I know we talked a little bit offline before this thing, and it took me 3 times to get on the board, and so I lost the first one, lost the second one, and here's a crazy story. As I'm gaining momentum and gaining contacts and trying to learn more and be better, so I can be when I get on the board. That 3rd year, I forgot to put my application in.
No.
Yes, I missed the deadline for the application. Yeah. So that was I think it felt like a mule kicked me in the stomach. I'm not gonna lie. But, and then the next year I tried again and I was successful in that third attempt in 4 years, we should say. I don't know. It all turned out and it worked out great. And it's been fantastic to serve a international community of members that are so dedicated to their specialty and their profession. Greater than 54,000 members now worldwide. And we're just making a bigger footprint. And just grabbing so much stuff that can be resources for ED nurses so they can do their job much easier and to a higher level. Because, it's not getting easier. So what can we do as an association to make that the best that you can have? So, because ultimately we all want to have a great career.
Yeah.
So what can we do as a professional?
That's cool.
Make sure you do have an excellent career.
Now you mentioned GA. For those who don't know, what is that? What is GA?
Yeah, General Assembly. So it's kind of like the Congress, the body making some of the rules and some of the standards and practice standards and guidelines and suggestions and hot topics of clinical. And so it's kind of like Congress, if you will. I guess you could call it our Congress. Yeah. But it was when I got up there and I did the resolution, I did, a delegate a couple of years before that, but I was like, that's kind of really was the bug that bit me.
What was the resolution?
It was it's a site selection committee. So just having the ability to look at other ways that a group of people could come together and decide where some of the conferences might be held or just give some input from the members. So,
all right. That's kind of cool. That's kind of cool. Now, I always tell people if I can get people to go to General Assembly and just go to a national conference, we'll absolutely have them hooked in ENA.
Absolutely.
We'll absolutely have them hooked in ENA because there's nothing like it. There's nothing like getting up in front of a room full of your peers and saying, "Hold on, wait, I got something to say about this nursing thing," and just the realization that you as that one person can have that kind of effect on a profession is just mind blowing. It's just mind blowing.
Yeah. And for, we talk about why it's important to become a member of ENA. I just remember back looking at my job and I was at a system level meeting and we were talking about delegation. And so at the time, the assistant CNO looks at me and she said, "Well, Ron, you're involved with the ENA, right?" And that's when I was just involved at the state level, and I was on a national committee, I believe, at the time. And I said, "I am." She goes, what does ENA say about delegation?" I said, "I don't know right off the top of my head, but I'll find out." So I go, we look up our practice, a guideline. I think there was a practice resource on it. And I brought it back to her and we read it as a group and we're like, that's what we're going to go with. So cool. Basically we took what ENA did and implemented it into an 18 hospital system.
That's awesome.
So I right then I was like, wow, that is a powerful, our association is very powerful.
Yeah. Yep. I agree 100%. Now, one of the coolest things I got to see that you did in ENA was last year. All of a sudden I look and I see a picture of Ron Kraus in the White House with the president. In the White House, in the same room with the president. I see a video of you introducing yourself to President Trump. And I was just like, wait, what happened? How'd this happen? Tell us a little bit about that, because that's super cool.
Yeah, that was a crazy experience. So at the time, we got an invite to sit at the table and meet with the COVID task force. And Mike Hastings, the president at the time, is out in Seattle. And that's when it was just...
They were getting crushed.
Hotbed. Yeah, he was getting crushed and no way he could make that happen, fly across the country. So, I'm here in Indianapolis. It's a quick plane trip over there to DC. So I get called and they're like, "What are you doing tomorrow?" We got a chance to meet with the COVID task force team and represent emergency department nurses. I was like, all right, this sounds great. Let me call my boss and make sure
you're like, get off tomorrow. Sounds like that's what I'm doing tomorrow.
Yeah, exactly. That's what I'm doing. And ended up going, and it was an incredible experience. It was myself and 11 other nursing associations that were in that room with the COVID task force at the time, the president, the vice president. So we were in the cabinet room for about almost just under an hour, just talking about, each one of our individual specialties and area of what we needed as we went through this global pandemic. And now, mind you, this is March 18th. So this was the world stopped on March 13th, right? Yeah. That's when the global pandemic on Friday the 13th. So very, very new into the whole situation. So it was a great experience. I would to be able to sit at that table and represent not only the members of ENA, but all ED nurses
around the country.
Yeah, around the country, even in the world, right? I mean,
yeah. Right.
So to be able to represent ED nurses in our specialty, in an area that I love, it was awesome.
How cool is that? Did you you had to left there feeling like just like $1 million. You just had to be like, this is the coolest thing ever.
It was crazy. I grew up in a small rural town, and it's like one of those funny stories. Ronnie goes to DC. So it was incredible. It was incredible. It was surreal. I think the night before I could hardly sleep. I was so nervous. But at the time when we were in the room and talking and having a discussion, it was pretty free flowing, and it was a really great experience. So
that's cool.
Yeah,
that's cool. What a cool thing. Now that brings me to my next question. Like, is that the coolest thing you got to do in your presidency? Because I think that'd be the coolest thing for me, but was it the coolest thing for you?
I don't know. Maybe being on this podcast.
That is a great answer. That's a great answer.
That's up there, right?
Because the podcast and the White House, like right there, like. I
mean, they're pretty close.
Real close together.
Yeah. Yeah. No, that was definitely a pretty cool thing. I was president-elect at the time, but
yeah,
one of the things that I do miss about this year is connection with members.
Yeah, I was going to say, you probably didn't get a chance to get out much.
Not as much, my predecessor, Mike Hastings, he got none because we were just stuck, and he did a fantastic job leading this association through an incredibly crazy time. He was the right guy at the right time for the right job. He was fantastic. And now I get to travel a little bit, not as much as what we normally would, but yeah, that was the one thing I was kind of really looking forward to, is to travel, getting out there, because I love talking to people. I love meeting new people. I love hanging out with people, telling stories and connecting. That's my jam. That charges my battery up. So when a lot of those were taken away by the pandemic, I mean, it is what it is, and we make the best of it, right?
Yeah. You don't get to pick your year, that's for sure. So
no.
But still pretty cool. So okay, that aside, during your presidency, when you're actually the president, what's been the coolest thing so far this year?
Oh, there's so many cool, good moments. Man, I don't know. I'm trying to think of some of the. I mean, I like the virtual town halls. I don't know. I mean, I like the state and chapters leaders, even though we couldn't do it in person. I thought we did a bang up job there. Just knocked it out of the park.
It was really good. It was better than I expected. Like I'll be honest with you, I didn't have high expectations. I was kind of like, well, they're going to do what they can. It was good. I thought it was good.
And working, and so for some of your listeners that may not know, the Emergency Nurses Association employs close to 100 people that are not nurses. Not all of them are nurses. I think there's just a few nurses on staff, but they're all specialists in their own area. So we got finance people, we got marketing people, we got PR people, education specialists, et cetera. And being able to work with that group of people at a high level and just see that the passion that they have to help support us.
It's pretty cool.
To see that aspect of it is a super cool thing. I'm not gonna lie. It is just really amazing to be even a part of that, and seeing, I love this, the strategic thinking and where we're going to go. And as an association, I think that's just being able to work like that. And the board of directors we have is amazing. This year, and I'm very fortunate to be able to sit as a president with this board. And I don't know. I mean, I just see us going some really big places, Kevin. I mean, some big places coming forward for ENA.
What do you hope your legacy is as your time as the president?
I think one of the legacies I hope to leave is the ability to help us get on that road to healing as individuals, as a profession, as an organization. I look at this and I'm trying to transition what we're doing. I thought we might be a little bit farther along. And then, when we're having this conversation is, so I thought we'd be a little bit farther along into that healing process and not being snapped back. But I just want to be able to continue to have ENA as a place that people can come to on a multitude of ranges. One of the things that we're getting ready to launch is the ENA University. And when you get to start pecking around in that and the potential that's there, I think is going to be a legacy that's going to live on for a long time. So the ability to say that ENA University was launched under my presidency year is going to be pretty awesome, because I think it's really going to drive a lot of things. So,
what's that going to be? I've seen it. I haven't paid close attention to it. I'll be honest with you. What's it going to be?
It's going to be a multitude. It's going to be a launching pad for a lot of things. Right now it's like a lot of it is conceptual, but we just keep thinking it's going to be bigger and bigger and bigger. So a pathway for maybe a new novice nurse, how they can get to, might be having a crucial conversations class. It might have something else along those rounds, something kind of like you would do at a hospital. But can we do that as an association? Cool. If you want to be a charge nurse, there's going to be like a management pathway. So you get on these little pathways, and we can help you connect with whatever you need to give you the resources to do the best you want to at that. I don't know, the sky's the limit. We just keep, that's the cool part about being on the board of directors is, we're strategic and try to think visionary ahead. How do we keep our association bigger, better, and the premier association for emergency nursing?
Hey everybody, Kevin McFarland here. I hope you enjoyed that episode as much as I enjoyed recording it for you. Thanks again to Ron for taking the time to talk to me. I really appreciate it. I know you were super busy during your presidency, and I really appreciate you taking the time. Now, as promised, I'm going to give you just a quick taste of the upcoming podcast, How Not to Kill Your Patient, with me and the amazing Dr. Lisa Wolf. Here you go.
So that's the basic framework that we use, right?
Okay.
The idea of triage, and I say this a lot, is that the very best nurse in your emergency department should be doing triage. It is the most important decision for most patients, is that ESI acuity. You're actually supposed to put your hands on the people.
Oh. I knew that. I knew there was something I was doing wrong.
Yeah.
And I always document breath sounds, and I never carry a stethoscope.
Oh my God.
No problems, right? No problems. You're like, how do you kill your patient?
That's a great way to kill your patient. Missing information will kill your patient. Oh my God.
Okay, so respiratory rate. So people don't necessarily count it. Is that what you're saying?
Right. And it's super important because it tells you all kinds of things, right? Like acidosis and hypoxia, stuff like that. So.
All that bad stuff.
Right. Yeah. So that's why I think when we talked about doing this series, we wanted to really take some time and have people walk through the things that will kill your patient and how to avoid them.
How to avoid them, because killing your patient's bad. Like I don't know if maybe I'm spoiling a punchline here for the podcast, but killing your patient's bad. A lot of paperwork.
Lots of paperwork. Lots of moral distress.
Lots of moral distress.
Lots of drinking is bad.